Hello, everyone. Just a couple more minutes where you got a few more people signing in here, and we'll start our webinar in just a minute. Welcome to today's webinar called OSHA's New Approach to COVID-19 Prevention in the Workplace. Our main presenter on this topic is Katie Olson. A quick little background about our organization. Both Hazmasters and Connie Safety are subsidiaries of Wesco Annixter. Wesco had acquired Annixter last year to create a premier electrical and data communications distribution and supply chain service company. Our safety consulting team here at Connie Safety has over 100 years in combined safety experience, and we want everyone to know that we are more than just a safety product distributor. Our safety experts provide a holistic approach to creating safe work environments. We are a firm believer in customizing our training whenever possible for clients and actively keeping employees involved in the training, both from a training perspective and the organization's safety culture. And we feel this is one of the keys to our customer success in their safety program. So hello, my name is Michael Tesmer, and I'm the Safety Services Manager for Connie Safety Products. As I had mentioned, our main presenter is Katie Olson, who is a national safety consultant on my team based here in Madison, Wisconsin. Katie and I have both presented webinars on COVID-19 throughout the pandemic last year, and our intention is to help frame the new OSHA guidance that was posted back on January 29th, 2021, as a result of an executive order by the White House. What does this mean for your business, and how can you ensure that you are taking the correct steps to help keep your employees safe while at work now or with their eventual return back to the workplace? So prior to 2020, I really cannot think of any safety professional or business leader that would have ever imagined a brand new workplace hazard that literally affects every business out there. You know, from a small accounting office to the largest meatpacking facility in the United States. It's just crazy. So while overall new cases have been going down around the country, COVID-19 cases directly in the workplace have been on the rise. There are certainly more reasons than you might realize why businesses can play a critical role in slowing the spread of this particular virus. Your place of business, it actually can help set an example of how people should be treating this pandemic when they're away from their work. You know, you got social distancing protocols, wearing appropriate masks, limiting contacts of surfaces touched by others, frequent hand washing, sanitizing, etc. You know, those are all things that businesses help set that example on. OSHA, they're just simply trying to make it clear that employers have a responsibility to keep workers safe from this virus and they do have appropriate plans in place to deal with employees who are found to be at work exhibiting symptoms. So while you may think most of the OSHA investigations are strictly around healthcare related facilities, such as nursing homes, dental offices, things like that, here in Madison, about 40% of the focus is on normal workplaces like offices, warehouses, even manufacturing plants. A a recently published survey found that more than half of the workers surveyed did not feel adequately protected from COVID-19 while at work. So even though I might be able to assume that most of you do not work in a meatpacking plant, this graph on this slide here can give you a feel for the problems that were being encountered in 2020 for workers in this particular quote essential business, which struggled mightily with COVID-19 due to the social distancing concerns. So these are workers that are traditionally working side by side during cutting, trimming operations, in a meat packing plant. So without any OSHA standard in place, protocols to keep employees from getting sick and potentially dying were maybe not as high of a priority as some employers, or they simply didn't realize that what they could be doing to help keep employees safe. So ultimately, the CDC actually did come out with some basic guidance, even some directly specifically designed for the meatpacking plants to help deal with this crisis. But now we might be entering into some new regulations that will be enforceable and requiring accountability by the employer. So that's what we're going to be talking about. So with that, I'm going to turn this over to Katie Olson. Katie?
Thank you, Michael. As Michael mentioned, COVID-19 is increasingly becoming a workplace hazard, with workplaces contributing significantly to the overall number of positive COVID cases that we've seen in the country. To combat this, the Biden administration issued the executive order on protecting worker health and safety, which we're going to take a look at. So the order, which was signed on January 21st, 2021, charges the Secretary of Labor with the task of making workplaces safer from COVID-19. Through the use of science based guidance, the Biden administration calls on OSHA to do a number of things, but primarily what we're focused on are the three shown here. So, the Biden administration calls on OSHA to issue a revised guidance to employers on workplace safety during the COVID pandemic. There had been some guidance out there, a lot of it kind of stemming from what already existed with the CDC. But in this particular executive order, the OSHA was charged with revising that guidance, beefing it up a little bit to help keep workers safe during the COVID pandemic. They were also charged with determining if an emergency temporary standard was necessary and, if deemed appropriate, to enact that emergency temporary standard by March 15th. A little bit later, we're going to talk about what even is an emergency temporary standard, as well as what we think this particular one could look like. Also, OSHA is to launch a national program to focus on enforcement efforts related to COVID-19. Also, a little bit later in the presentation, we're going to look at some of the enforcement activities that OSHA had taken part in 2020 as a response to the COVID-19 pandemic. So you can see, just how seriously OSHA was taking this even before these guidances were in place. I mentioned that this new executive order called on OSHA to revise their guidance. This revised guidance was issued by OSHA on January 29th in response to this executive order. And here we have, this revised guidance that really is intended to be advisory in nature, informational in content, and intended to assist employers in providing a safe and healthful workplace. Well, what does that all mean? It's not law, right? So this is guidance. It's not intended to be, enforced the same way that a typical OSHA standard would be. Well, If it's not law, then why do we care? Well, we mentioned the potential for an emergency temporary standard, and in there, there's a very big likelihood that that emergency temporary standard is going to be based off of this guidance. So, even if you don't think that this is going to be law, or you don't think it necessarily pertains to you, I really encourage you to kind of, take this information that we're sharing with you, tuck it away in the back of your mind in the event that this emergency temporary standard does happen, and you had to have this information and implement it in your facility. Like the older guidance, it does incorporate a lot of the recommendations from the CDC, especially around things like wearing masks and social distancing. But the key player here in this revised guidance is really the implementation of what OSHA calls a COVID-19 prevention program. And we're going to walk through what that actually looks like. In this new guidance from OSHA, it highlights a couple things. 16 elements that they say are crucial for a successful COVID-19 prevention program, as well as more detail on what they call key measures for limiting the spread, going above and beyond what these 16 elements are into really highlighting the employer's responsibility for limiting spread of COVID-19 in the workplace. So we're going to take a look at this in a little bit more detail now. We're going to highlight those 16 key elements as well as the key measures. So first and foremost, as part of a successful COVID-19 prevention program, OSHA says that you need to assign a workplace coordinator. And for the most part, if I had to guess, it's probably going to fall onto the safety person within the organization, which is fine. But ultimately, you want this to be someone who is going to be responsible for handling all COVID-19 issues on behalf of the employer. So whether it's a safety person or an operations manager, it should be someone who is not only familiar with the operations of the facility, but also familiar with the information in this presentation and the requirements of these COVID-19 prevention programs. The second element of this prevention program is really kind of the beefy part of it, right? Perform a COVID-19 hazard assessment. And that's not going to be an easy task. It should be performed to identify where and how workers might be exposed to COVID while they're at work. And this could be huge. It could be just, from employee-employee interaction, or if you have employees who are, coming in contact with the public throughout the course of their workday, there's probably a lot more exposure that you have to consider there. But performing this COVID-19 hazard assessment is a key element of a successful program. Once you have determined where the hazard is likely going to present itself, you have to then create or identify measures that are really commensurate with the hierarchy of controls to limit the spread, really focusing on those engineering controls like ventilation, social distancing, over reliance on PPE. Really kind of like any other risk assessment that you would do in the safety world, right? Identify the hazard, determine how we're going to mitigate that risk, right? So this is no different. We're just taking those principles and adapting that for COVID-19. Next, we know that older adults and those with serious underlying medical issues are at a greater risk for developing severe illness from COVID. So how are you planning on protecting those populations? Now, obviously, you can't just go around asking your employees if they have underlying medical conditions, right? Huge violation there. But just understand that through the Americans with Disability Act, those individuals who do have those underlying medical conditions or could be at a higher risk for severe illness, they may have protections or they may have eligibility to have what's called reasonable accommodations through the Americans with Disabilities Act. So this is something that you definitely want to partner with your HR, partner with to kind of identify what you're going to do in terms of having those additional protectors for workers at higher risk. When I think back to the start of the pandemic, and even here at Connie Safety, really what played such a vital role in the success of us being able to migrate to a mostly remote workplace, everybody working from home, was the level of communication and the effective communication that was flowing back and forth as a two-way street between the employees and management. And that is something that you have to have in every workplace. You have to have an an effective communication system, not only for employees to be able to, convey to you that they are experiencing symptoms or that they have concerns regarding the effectiveness of your, protective protocols that you have in place, but you also need to be able to communicate with your employees. If there has been a positive case, if you do need to alter the way your operations are going in some capacity, that needs to be done through this communication system. So having that in place before you start to you roll out this prevention program is going to be super helpful for you. Then, just like every other hazard in the workplace, OSHA requires training on how to protect themselves from COVID for all employees in a language that they understand. So think about how you're going to convey that. Even if the training is something as simple as, showing them your COVID-19 prevention program, you still have to make sure you have all of your bases covered when it comes to, providing that in a way that is going to be receptible, easily digestible for those employees who you're looking to train. Next, we always tell people if you're sick, stay at home, right? Easier said than done. A lot of people, have their PTO tied to sick time. And so the time that they stay home sick is less time that they get to take for a vacation. And we need to encourage people to stay home when they're sick. So think about your apps and policies. Again, this is another opportunity to group together with your HR function. But think about your absence policies. Make sure that they're non-punitive. Make sure that people understand that if they are sick, they need to stay home. It is their social responsibility to stay home so as not to spread this virus. And then the other thing that you can do is listed here as number 8 is minimize the negative impact on sick workers. Can you allow for flexible working schedules? Do you have policies where people can work from home? Can they telecommute? Maybe you have some type of paid leave system that was set up to kind of mimic the Family First COVID Response Act, where people can get paid time off if they are sick with COVID or taking care of someone who is sick with COVID. Definitely check with your HR partners on that, because there is some variability when it comes to which employers are actually subject to that particular act. Next, think about how you're going to isolate workers who show symptoms at work. So maybe you have a process to screen employees as they're coming in. You're taking temperatures, you have a questionnaire that they're responding to if they have any symptoms. What if you have an individual who actually does display symptoms throughout the course of their workday? Is there a place where you can isolate them? Do you have an office or a location set up for them to go and be isolated until they can go home or they can leave the facility? This is definitely something that is going to help transition for workers who are sick that may need to leave work. Then, after that, develop an enhanced cleaning and disinfection plan. Again, really kind of in line with the CDC's recommendations. They have a ton of really great resources in terms of how you can go about cleaning and disinfecting a workplace after someone has been identified to have a positive case of COVID. Really what you want to do is target all of the areas where the infected person worked, right? So close off those areas if you can, not maybe just their specific work area like their office, but think about bathrooms, break rooms, any other common areas, coffee stations where that particular person might have been. That needs to be included in that cleaning and disinfecting protocol. Wait about 24 hours before actually going in there to clean. That's a pretty good time frame to allow any virus that could potentially be on the contact surfaces in those areas to die out, and then go in there and follow your cleaning and disinfection plan. Testing and screening is something that is going to be and has been kind of a key player in many industries as we've moved forward in the pandemic. One industry that I think has done a really great job at implementing this screening and testing is actually the showbiz industry, right? The entertainment industry. You think about celebrities. I follow a lot of them on Instagram, right? But they're posting, they're getting COVID tests on almost a daily basis to ensure the safety of not only them, but the crew and the other, celebrities and actors that they're working with. And so I think that's just a really good way that particular industry has been able to adapt to, implementing these protocols to help keep their employees safe. And it is kind of weird to think about, but the entertainment industry is just like any other industry, those people are employees, so they are subject to the same regulations as other employees. So we need to be able to, if you're not necessarily providing the screening and testing on site, if we don't have those capabilities, then we need to provide some type of guidance to our employees on how they can go about getting screened or tested. Um, Take a look at your local public health department webpage. They will have a list of screening or testing facilities in your area. You want to make sure that you're giving people time to go and get screened or tested for COVID-19. That again, we're not having any type of punitive actions for taking the time to go and do this. On the topic of having your employees screened, well, what happens if you have a positive case? Um, Implementing a record keeping and reporting system within your COVID-19 prevention program is critical. COVID-19 is a recognized hazard, and if a case of COVID-19 can be traced back to the workplace and is deemed work related, it falls under the same record keeping rules as any other work related injury. And that's been a huge miss on behalf of employers throughout this entire pandemic. In fact, when we take a look at some of the most commonly cited standards in some of the recent OSHA enforcement activity, you'll see that this record keeping one is one of the highest. And it's something that I think is going to continue to be a struggle as employers are still trying to kind of navigate whether they think COVID is work related or not. Whether it is or it isn't, just like any other workplace injury or any type of concern that an employee brings up, we need to make sure that our prevention program includes some type of instruction to protect against retaliation, right? We don't want our employees to be retaliated against in the event that they do report their concerns, whether it's to you, the employer, or directly to OSHA. We need to make sure that people feel safe in communicating their concerns, as well as if they are experiencing any symptoms. Vaccination is they're getting out there. People are getting vaccinated. Unfortunately, not at the rate that we were initially hoping for, but we have subsets of the population that are vaccinated, which is fantastic. You may have the opportunity to provide vaccinations for your employees free of cost to them through your workplace or at your workplace. If that's not the case, we do want to make sure that you are still providing that guidance on where they can get vaccinated, how they can sign up to get vaccinated. A lot of places right now, you're kind of entered into the pool based on what your eligibility is, and then you can sign up online. If that's the case in your area, we want to provide that information to our employees. We want to make sure that we allow them the time to go get vaccinated, all right? We're not requiring them to take PTO to go get vaccinated. We want to encourage them to get this vaccination because it's going to help make the workplace safer, right? The more people you have vaccinated, the less you're going to have in terms of spread of COVID. And as we move forward and we're getting more and more people vaccinated, we still want to make sure that we're making no distinctions between people who have been vaccinated and not. So just because you're vaccinated doesn't mean that you can go around, not wearing a mask, you're not social distancing anymore. There's still a lot of data yet that we have to receive and digest before we can say for sure, people who are vaccinated aren't actually spreading it. So we need to make sure there's no distinction being made. Once you have people who are vaccinated, you still want to make sure that you're enforcing and implementing all of the other elements of your COVID prevention program, regardless of if people have been vaccinated or not. And then finally, any other applicable OSHA standards that pertains to your particular workplace that could also spill over into COVID-19. Again, when we look at those enforcement activities a little bit later, you're going to see some examples of some of the OSHA standards that have been used and cited against when these OSHA inspectors are going out into these workplaces as it pertains to COVID. Things like, I mentioned record keeping, but also personal protective equipment and respiratory protection. So what other existing standards do you need to kind of lump into your COVID-19 prevention program? So those are the 16 elements, and a lot of them, again, pretty basic. A lot of them are taking, existing kind of safety principles and then applying them to COVID, which is fantastic. It should kind of help you ease into, developing and implementing these programs. The next thing that OSHA talks about in their updated guidance is really what they call these key measures to eliminate spread in the workplace. And these are things specifically that our employers should do, emphasize should do, in order to make sure that they're limiting spread in the workplace. And the first thing is isolating and quarantining, or ensuring that their employees are isolating and quarantining as appropriate. So let's talk about this, isolating versus quarantine. This is something that a question that comes up a lot when I am talking about COVID, people who have COVID. There's kind of some confusion around the difference between these two terms. So let me see if I can clear this up for you. Workers who have had COVID, folks who have tested positive, they've had symptoms, right? They have definitely had COVID. Those people isolate, okay? They isolate and can return to work after at least 10 days since symptoms first appeared, and at least 24 hours with no fever without the help of fever reducing medications, and other symptoms of COVID-19 are improving. They're getting their taste back, they're getting their smell back, things like that. Please note the bold and, right? So all three things, all three of these requirements need to be met in order for that person to safely return to work and ensure that they will not infect anybody else. Now, some people may need to stay home longer, especially if we have those who maybe are subject to, more severe illness from COVID-19. They would need to work with their healthcare provider to determine if there was going to be an extended length of time that they would need to be out. Now, on the flip side of that, workers who have been exposed to COVID-19 quarantine. So these are people who maybe were a close contact. They've been around somebody who was confirmed to have COVID. They haven't tested positive. They may not potentially have any symptoms. They need to quarantine. They need to stay home for 14 days after their last contact with a person who has COVID, and watch for symptoms of COVID-19 and stay away from other people, especially those that would be at high risk. Again, all of these criteria need to be met. All three of those boxes need to be checked before that person can return to work safely without fear that they're going to infect anybody else. Once people are working, if you have some folks who are actually back in the workplace, we want to implement social distancing in all communal work areas. So break rooms, bathrooms, coffee areas, workspaces, right? Especially, Michael specifically mentioned the meatpacking industry and how kind of there's close quarters there. We need to modify those workstations as much as possible. So one way to implement social distancing, number one, is just limit the number of people that you have in a place at a time. So that could be, you do split shifts where half of the folks come in at one part of the day and half of them come in, later in the day. Maybe you're staggering breaks, so not everybody is taking lunch at the same time. We just need to make sure that we're not having the total population of your workplace in an area at any given time. 6 feet has really kind of been the general rule in terms of how far you can be away from people without contracting COVID. That generally comes from the notion that those respiratory particles that can contain COVID can travel in air up to 6 feet. So we want to make sure that we're keeping 6 feet, at least 6 feet between employees. I mentioned the meat packing. How can you alter those workspaces? We're going to talk a little bit about barriers, the actual physical barriers here on the next slide. But, when it comes to people who are interacting with customers or the public, what are ways that you can actually maintain social distancing, right? If you're working at a Starbucks, I mean, it's very hard for you to maintain social distancing if you're having to take someone's credit card or hand somebody their coffee. Maybe you can set up policies or procedures where you set the coffee down and walk away and then allow them to come pick it up. Those are all kind of administrative controls that you can utilize to maintain that social distancing. Think about, again, those vulnerable employees. Maybe we need to do a little bit more to minimize their contact with public or other workers. Think about those industry-specific guidances. Go to CDC's website. Meatpacking was a big one that we looked at. I mean, there's some for childcare agencies. There's some from for healthcare agencies. So take a look and see if there's any specific guidance for your industry. Otherwise, all of the stuff that we're talking about here today is good stuff that you can use and implement at your facility. I mentioned barriers, physical barriers where social distancing cannot be maintained. And we've all probably seen the plexiglass separators or dividers. They're typically put up in front of the cash registers for the folks who are at the grocery store. You really to put that physical barrier. But please just know that that is not a true replacement for social distancing. Having those barriers are great, but there is still a need to have that 6 feet separation wherever possible. Think about all of the aspects of that person's job before you go and install one of those plexiglass shields. Think about how they're going to have to move throughout the day. That it can, move with them or cover the whole area that it needs to cover to ensure that we're actually preventing that person from coming in contact with anybody else. Masks have been in the news a lot recently. Probably you guys have seen CDC making the recommendation that 2 masks are better than 1. I would argue that's probably always been the case, but with the emergence of these new variants, we know that are up to 50% more transmissible. The use of masks is just becomes so much more critical, even than it has been in the past year since this all started. So, suppress the spread by requiring face coverings in the workplace as an employer, requiring your employees to wear face coverings, providing all of your workers with face coverings at no cost to them is critical. Based on CDC recommendations, face covering should be at least 2 layers of tightly woven, breathable fabric. They should fit snugly over your nose and mouth and have no gaps. CDC recently published some pretty interesting data around kind of the common face covering schemes that are kind of out there right now. So a lot of people utilizing these 3-ply surgical masks. Based on the research that was done by the CDC, these 3-ply surgical masks are about 42% efficient at protecting the wearer from COVID. If you up that to a 3-ply cloth mask, which is just your standard, I like to call them a fashion mask that you can pick up at in any retailer, that ups your protection to about 44% efficiency. Now, taking into account that new recommendation from the CDC, taking 2 masks, a cloth mask plus a surgical mask on top of it, that's getting you 92% efficiency when it comes to protecting the wearer from COVID, which is great. And you go even a step further and you look at an N95 or a KN95 mask. Now you've got 95% or more protection against COVID-19. And the benefit to having an N95 or a KN95 is that you're not wearing 2 masks. It's a little bit more comfortable. In N95s right now, we're still seeing a shortage, even this far into the pandemic. I saw an article in the news this morning that said that hospitals are still having to ration out these N95 masks. So if you are an employer, if you are looking to have the most effective mask for your employees, leave the N95s to the healthcare folks and look at the KN95 options. They are just as effective as an N95. There are some really great options out there right now. And they're comfortable. Again, they're just as effective and they're cost effective rather than going through these 3-ply surgical masks. So something to consider as you're looking at requiring your employees to wear a mask. Improving ventilation. We talked about once you've identified where the hazards are in your organization, putting together some type of control plan that's commensurate with the hierarchy of controls, really focusing on those engineering controls. And for me, ventilation is really kind of the end all be all when it comes to engineering controls, especially as someone who came from a chemical background working with a lot of chemicals. Our first goal was always to minimize the risk by having some type of ventilation in place. And we're talking about office buildings, we're talking about other places that maybe don't necessarily have really high quality ventilation systems. But there are some basic things that you can do to kind of just improve what you have and work with what you have. So number one, ensure current ventilation systems are operating properly. Make sure that what you have is already providing an acceptable indoor air quality for your employees. And if you can increase the ventilation rates, do so. Increase them as much as possible. The more air changes that you have in an hour, the better it's going to be. If you have recirculation error, stop. Don't have any recirc error, obviously, because it's going to just recirculate particular any virus that could be in the air. If you have demand control ventilation, also discontinue that. Make sure that all parts and all aspects of your ventilation system, including filters, are on a preventative maintenance schedule so that you know to switch them out and you're never letting them go beyond what their life cycle is actually intended by the manufacturer. You know, think about a way that you can move air differently, from clean to less clean. Evaluate, the positioning of your supply and exhaust diffusers and your dampers, things like that. If you are kind of, bound by the ventilation system that you currently have, you can't change it. Reduce the occupancy level, right? Again, fewer people in the building are going to have a better impact. It increases the effective dilution ventilation per person. So you're actually exposing less people and recirculating more, or not recirculating, but circulating more air, which is definitely something that you want to go for. In addition to providing adequate ventilation, we also want to make sure that we are providing our employees and customers, for that matter, to have ready access to things that are going to help them practice good hygiene with regards to preventing the spread of infectious diseases. So make sure that they have tissues, access to no-touch trash cans, hand sanitizer dispensers, soap dispensers. In addition to just making sure that they have, soap and water or hand sanitizer, allow them to have time to practice good hand hygiene, give them time to make sure that they're washing their hands appropriately. I'm not huge on safety posters. I think sometimes they kind of can overdo sending the message, and they kind of become background noise to a certain extent. But I've seen posters like the ones shown here, you posted in different locations in a really effective way, to really kind of grab people's attention. This is from the CDC. We also have some other resources through Connie has masters as well, but really just serving as a reminder, right? Wash your hands for at least 20 seconds. And, most importantly, making sure that as an employer, we're providing all of these things at no cost to the employee. Now, I mentioned earlier, we talked about these guidances. They're not law, but one of the bullet points, when it comes to that executive order from the Biden administration, was that OSHA has to really kind of consider whether or not an emergency temporary standard is going to be required, and likely could incorporate all of those things that I just talked about. So if there is going to be a COVID specific emergency temporary standard, what can we expect out of that? Well, I guess first and foremost, what is an emergency temporary standard? This is essentially a temporary OSHA standard, and it takes effect immediately. And that particular standard is in effect until it is superseded by a permanent standard. So it is something that is going to remain in place until a permanent standard is registered. OSHA published this emergency temporary standard in the Federal Register, where it actually serves as a proposed permanent standard. So if you guys are familiar with the process in terms of how OSHA creates the standards, we're cutting out a big chunk of time here by already putting this in as a proposed permanent standard into the Federal Register. Now, once it's in the Federal Register, it is subject to the same procedure for adopting a permanent standard. However, with an emergency temporary standard, this should be done within 6 months. So taking, a temporary standard, making it a permanent standard can take anywhere from 3 to 5 years, sometimes longer than that. We're saying here from the time that it's the proposed standard to the time that it's actually a permanent standard should be 6 months. So it expedites the process, which is going to be really great for making sure that employers are being held accountable for keeping their employees safe. Now, many states have implemented their own emergency temporary standard. Those would be states that have their own state-run OSHA. Currently, there is no federally, mandated emergency temporary standard. But we're thinking it's very likely that this is going to happen. And if it does, based on that executive order from the Biden administration, it has to be put in place by March 15th. So clock is ticking. So what can we expect from a COVID-specific emergency temporary standard? Well, we can kind of get a good idea of what to anticipate just by looking at the state plans that are already out there on what we can reasonably expect to be included in this federal standard from OSHA. First and foremost, written response plan, a COVID-19 prevention program with the 16 elements that we discussed earlier on is going to play a huge role in this temporary standard, as well as reporting and notification requirements. How are you going to ensure that you are doing appropriate record keeping when it comes to tracking these COVID cases in your workplace? We talked about that hazard assessment. It was one of the 16 elements, right? Probably going to have a specific requirement in the emergency temporary standard for hazard assessments for each task in the workplace. And then every other, just like every other OSHA standard, training requirements, right? How are you going to train your employees? How often are you going to train them? What's the format that they're going to receive the training, right? And that's going to kind of encompass everything, right? It could be just the written instructions on the COVID-19 response plan, or it could be how to, follow good social distancing guidelines, good hand hygiene, right? So we can, I think, reasonably foresee that these four elements are going to kind of play a huge role when it comes to this emergency temporary standard. And now, why am I telling you this? Well, OSHA has already been enforcing these rules even without the temporary standard. And I've kind of been alluding to this early on, but 2020 was kind of a big year for OSHA in terms of enforcement activity as it pertains to COVID-19. So as of January 14th, just last month, OSHA has issued penalties totaling over $4 million to employers here in the U.S. that have not done their job to keep employees safe from COVID-19. And there is a list actually on OSHA's website. It lists out every single citation that was issued to every company that it was issued to. So I encourage you to go take a look at that. But just to kind of pull the key information off of that list, some of the commonly cited standards that are cited against for these employers are, as I mentioned before, the record keeping and reporting occupational injuries, right? People who have not been putting these COVID cases on their OSHA logs, even though they are work related. General requirements for having PPE, right? So taking a look at the standard of actually giving people PPE, training them on how to use the PPE, to care for it, when they need to change it out and replace it. Those are all kind of key principles when it comes to having PPE that people are just not following when it comes to COVID-19. Respiratory protection has been another one that's often cited. We saw a lot of kind of leniency at the very beginning of the pandemic when it came to people having kind of some leeway when they go to do their enforcement inspections, based around just the availability of some of the respiratory protection that we had. But we were still seeing a lot of employers that weren't necessarily following those guidelines. They were adapting these new respiratory protection plans and not fully implementing the plan per the OSHA standard or what would be required under the OSHA standard. And then finally, the general duty clause. And this is really a big one. COVID-19 is a recognized hazard, right? And general duty clause says that as the employer, you are responsible for providing a workplace free of recognized hazards for your employees. And, if you're not doing that, and if it doesn't fall under any of these, other listed standards, then they can cite you under the general duty clause. They're well within their right to do that. So given that OSHA already has fined over $4 million when it comes to citations on employers with regards to COVID, how will enforcement change when they actually have a standard to enforce against? Don't wait to find out, right? Because it's only going to get worse. We highly highly encourage you to start implementing a COVID-19 prevention program now. So maybe you need help with that, and that's definitely something that we can help with. We have tons of resources between Connie and Hazmasters, so whether you need just some of the handouts that are shown here, some things that you can post around your facility, all the way to helping you develop your written program, helping you locate supplies, whether it's PPE, cleaning supplies for your cleaning and disinfection protocol, maybe supplies that help with social distancing, signage, floor stickers, things like that. We definitely have the product and the expertise to help you identify a solution. As Michael mentioned earlier, we want to help you find a holistic, right, an end-to-end solution to help you stay in compliance if and when this emergency temporary standard comes into play. So if you're interested in learning more about our COVID-19 services, I highly encourage you to reach out to us with the information that is shown here. Give us a call, send us an email. We have a team of safety professionals who are here to help you.
All right. Thank you, Katie, for that overview on this new OSHA guidance. Great takeaway on key things, we need to be considering for any place of business and how we can go about ensuring our employees are kept safe. As Katie mentioned, just being aware and getting a handle on this approach right now makes good business sense. Whether you heard this presentation now or if it was given to you after March 15th, nothing should have changed in this presentation. And we just feel having organizations looking at these protocols now is a positive strategy. It's good stuff to be thinking about now and planning for. So with that said, we will get to a few questions I saw come up during the webinar. So, Katie, one of the questions came in. People take time off from work every winter because they get the flu from a coworker. Yet nobody ever reports that on their OSHA 300 log. So, why would they need to do any different for COVID-19 cases?
Sure. And this is a question that actually has been coming up a lot, especially since we've had so many, employers that have been cited for record keeping. And the answer to that question actually is in the record keeping rule itself. So if you take a look, OSHA does require you to report all work related infectious diseases outside of the common cold and flu. So they make that caveat to say that the common cold and flu is actually not included in the requirements, but any other infectious disease, and COVID-19 definitely falls into that category, must be put on the OSHA log if it is indeed work related. And because of just the how easy this is spread, it's pretty clear and sometimes pretty obvious that we can trace it back to the workplace in terms of how it was contracted.
Yeah, no, that's a good response. Here's another one. We have a canned written program that we have had in place since last summer. And, I've talked to a lot of people that have, kind of generic plans. It sounds like we are expected to customize it for our facility? Question mark. What do you think of that?
Yes. So, as specific as you can be to your workplace is critical. I want to say when we first started off with the pandemic, a lot of companies kind of moved to implement some of these kind of canned programs, which is great because it was better than what they had, which was essentially nothing, right? So it was better to have this than nothing at all. Now, as we're moving forward, and when we have kind of the expertise under our belt and we know how things are operating within our specific companies, we need to make sure that any policy that we create around managing COVID hazards in the workplace is specific to our operations. And this is just really helpful to employees because it takes the guesswork out of it for them. It's very cut and dry in terms of what they are expected to do as part of their day-to-day operations, versus having to try to interpret where they fall within, one of these canned programs. So yeah,
Mhm.
as specific to your operations as possible is going to give you the most benefit in the long run.
Good. Here's a good one. Can our company make the vaccine a condition of employment?
Absolutely. and and this even when the vaccine was just starting to roll out, or I guess even before that, when we started getting all of these different companies entering into the clinical trials, this came up, and they absolutely can make it a condition of em, you know employment.
Employment,
You,
yeah,
you think about a lot of healthcare, healthcare providers, they require, their employees to be vaccinated so that they don't, spread
right.
disease to folks who they're caring for. So yeah,
Yeah.
it's really no different than that.
Yeah, and it's interesting because I've even heard, the flip side of it. There are some employers that you think positively should make it a condition of employment, such as hospitals, and they
Mm,
don't. And it just might be
yeah.
based on just the way the board's set up and however the company strategized it. But there are some hospital systems that actually do not require their nursing or doctor professional staff to get vaccinated. So it's an
Hmm.
interesting question. Here's
Yeah.
one. So if an emergency temporary standard is put in place, do you think it will cover all infectious diseases or just COVID? I think you did kind of already just answer that with one of the other ones.
So it kind of depends, right? There is kind of an emergency need right now to have this standard pertain to COVID, but seeing as this emergency temporary standard is going to get placed into the Federal Register as a proposed permanent standard, I really think it
Mm,
behooves the administration to make it kind of more general or more broad to encompass all infectious diseases. And the groundwork for that was actually, laid during the Obama administration, and kind of has been pushed to the side since. But it kind of, I guess, will just depend on how quickly they need to get it through the system, right? There may be a little bit more resistance in, if they start to try to implement this, infectious disease program rather than one that is going to address the most critical tangible need that we're seeing right now.
good. What about my employees that work from home? Am I liable if they contract COVID?
No, you're not. So I work from home, right? If I were to get COVID, from someone in my household, or if I were to go out in public and develop COVID, no, there's no way. You are liable as the employer if your employee contracts it in your workplace, in your building, on your property. If they're working from home, they kind of fall outside the law on this one.
Okay. You mentioned that this new guidance is not law. How can I be cited for not following it?
Well, we've seen, right? OSHA is already citing folks. They may not be citing this particular standard because it doesn't exist yet, but there are
Right.
definitely other OSHA standards that they're looking at, whether it be the general duty clause, PPE, record keeping, respiratory protection. Um, I would say don't risk it. These are pretty basic safety principles that can be applied to COVID. So a lot of it could just be as simple as taking existing safety programs that you already have and kind of tailoring it to address COVID. But
Yeah.
again, it's something you don't want to wait and see, right? If they're going to cite you for it, just
In
implement
saying
the
that,
program.
well, it's kind of funny, Katie, and even saying that if this does become law federally, they could still be citing those other standards like they were in the past anyways, correct?
Absolutely,
Yeah.
absolutely. And they're also probably going to then cite the emergency standard on top of it too. So you
There
may
you
see
go.
it may be a twofer.
Yeah. Okay. So, hey, well, if we didn't get to your question, we do promise to follow up with all questions that were asked. We'll email you, or you certainly can always reach out to us. Anyone on our team, Katie, as well, at the contact information that we got posted here. So on behalf of Katie and myself, we thank you for attending our safety webinar and hope everyone stays safe and healthy as we continue to rebound here in 2021. So have a good rest of your day.